Hi, this is Markeitha, and welcome back to Healthy Living. Hope you guys are all doing well and staying safe. Now, to reach me, you can contact me at markeitha.com. That's markeitha.com. Also, healthyliving.company. There you can see my different items, especially at markeitha.com. It's my website. You can see the prior show, the current shows. Also, there's several products there. There's the Arbonne products. They're natural, pure, and beneficial. You can click on my link and go there and start shopping for healthy products. Right now, also, we're going to I'm going to tell you about Keita's egg toast and Keita's gumbo. Now, those are food items, so you would have to send me a message to request those items. You would have to send me a message for gumbo that comes with rice and hot water cornbread. The other thing is you can also contact me at the Next Level Studios here at 310-549-1113, 310-549-1113. Now, the producer of the show is TJ. That's TJAMZ. You can reach him at tjamsmusic.com. There he has a whole host of songs you can write lyrics to, send him messages. Also, he does web design, so you can send him messages at his website. You can also send him messages here at the Next Level Studios at 310-549-1113, 310-549-1113. Now, so I retrieved my information from News Yahoo /REP-John Lewis-Civil-Right. Okay, so also Cal OSHA, CDC website, things like that. Okay, so today I would definitely want to give a tribute out to Reverend John R. Lewis. He has been our civil rights person, and he's been fighting pancreatic cancer. He's 80 years old. He finally passed away on the 17th. He's our civil rights icon. He's been fighting against racism for decades. It started with the Jim Crow in the South and ended up in the Hall of Congress. The Georgia landmaker had been suffering from stage 4 pancreatic cancer. It started in December, and unfortunately he did not finish that battle. But we have all kinds of things that he has fought for us to give us rights, especially voting rights and the right to have our basic rights. But we still have a lot more to go. He was the son of an Alabama sharecropper. Lewis served in the Congress for more than 3 decades. He's been fighting for us, pushing the causes of a champion, original Freedom Friday. He walked with Martin Luther King there. Also, he challenged segregation, discrimination, and injustice in the Deep South, which there's still some issues there, but we've come a lot further because of him. Also, Black Lives Matter. They are taking up that battle to continue on, so thank you very much. Along with Martin Luther King Jr., he was the organizers of the March on Washington. Remember that in 1963 is a seminal event for civil rights movements, also that led to the passage of voting rights and blacks who, for us years later to have those rights to vote. So it's most important that you guys get out to vote for November's election. Very important. Register now. Reverend Lewis became a community activist near the Atlantic. He entered into and became a member of the Atlantic City Council before voting and receiving a seat with the Congress since 1986. Reverend Lewis would go on to become the best-selling author in 2011, where he was awarded the nation's highest civil award by President Obama, the nation's first black president. Lewis was elected in his 17th term in November 2018. All these years later, Reverend Lewis is known as the conscience of the United States Congress, still speaking his mind on issues of justice and equality. Obama said in 2001 as he bestowed the Medal of Freedom, and all generations from now, when parents teach their children about courage, the story of John Lewis will come to mind. An American who knew and changed what could be the weight of some of the others and some other times, who life is a lesson in fierce urgency now. So we have to keep fighting. We have to continue on. Okay, so let's go to some of the coronavirus updates. Now, according to today, we currently have across the world there's 14,599,773 deaths across the world. We have 607,056. And now we did have several that recovered. It's more than 8,695,972. Now the U.S. is leading right now in cases and deaths. The current cases are 3,871,065. Deaths is 143,166. Now the second leader in that, right behind us, is Brazil. They have 2,076,635 cases. They have 78,000 deaths and 871. The majority of the people that are infected with COVID-19, you will have mild symptoms, but some can get a little worse. Such symptoms include cough, fever. However, there's other serious symptoms as well, which includes shortness of breath, chills, repeated shakes, wood chills, also muscle pains, headaches, sore throat, loss of smell and taste. Now, the World Health Organization declared a pandemic on March the 11th. This virus started, the first report was in Wuhan City of China in December 2019. Has spread to 213 countries and 2 international. Now, what is it? It is the SARS coronavirus 2. It's a novel virus, meaning new. It's a severe acute respiratory syndrome virus. Also, there's a beta coronavirus like MERS, MERS coronavirus, which means Middle Eastern Respiratory Syndrome. Now, they all originated from bats. The outbreak was in Wuhan, China, December 2019. Then links, at first they said it was from open animal markets and seafood. It was from animal to person. Well, it quickly spread it. So now they realize it's now people to people. It spread it outside of China, and now it's across the world and internationally. Now, illness can range from mild to even death, unfortunately. Typically, human coronavirus cause mild to moderate respiratory illness. Symptoms are wide range. Most of the time, the mild symptoms you can manage at home, but notify your provider. They have flu-like symptoms usually. So right now, if you have flu-like symptoms, you need to notify your doctor because it could be coronavirus. Fever, cough, shortness of breath, chills. Also repeated shakes with chills, muscle pain, headache, sore throat, and a loss of taste and smell. COVID can cause more severe respiratory illness, you may have to go into the emergency room, or you have to make sure you call your doctor or call 911. Always call ahead. Now, if you call 911, you have to let the paramedics know that you might suspect yourself as having coronavirus. Immediate trouble breathing, pain, like pressure in your chest, having shortness of breath. If you feel new confusion, if your lips or face turn blue. Now, anytime you're changing colors, then you know that's a problem. If someone's with you, they should notify you. If you notice it, it's a distinct blue. You don't have to worry about, oh, do I see blue or not? It's very distinct. Men, do not delay your care. Men tend to wait a long time before they go to the doctor. Go to the doctor. Like I said, call the ED, the emergency department, emergency room. Call your provider ahead of time so they can prepare for you. So men, don't be hard-headed and call the doctor. Call 911. Now, who's more vulnerable? It's the 65 and older with multiple different disease processes. But nobody is exempt. Nobody is exempt. This coronavirus is just moving through everyone. Now, there's severe comorbidities, meaning diseases that you already have before the coronavirus, like heart disease, hypertension, lung disease, respiratory, also asthma, COPD, kidney disease, cancer, autoimmune suppressive diseases, HIV, leukemia, post-chemotherapy. Those kind of things are autoimmune suppressive. Also, be careful. Obesity is a risk factor because it causes more difficulties for your lungs to expand because of the excess weight. Children have what they call a multi-system inflammatory syndrome. That's what's happening with younger children. As of April 26, 2020, they found this in the UK. They recognized that children are having this disease, and it's similar to what we call Kawasaki disease. These signs and symptoms are fever, diarrhea, body rashes, red rashes, extremely red swollen tongue. They call it like a strawberry tongue because it literally looks like a strawberry. Red skin on the palms of your hand and on the palms of their feet. They also get red eyes but no drainage. They can have joint pains and inflammation around their major organs like their heart. And that's how some children are dying, is from the inflammation around their heart. So, COVID does not discriminate. Everybody has equal opportunity to get COVID. So no one is exempt. Now, if you do not have a doctor, you can call 211 to find a doctor that's in your area. So that's very important that you do those things. If you have cough, fever, shortness of breath, you call your doctor. They'll determine if you need a test. You have to make sure that you schedule an appointment before going to ensure that you can get that test and ensure that your doctor wants you to test. Now, healthcare workers, they are going to get their tests. They're going to be a priority because they're on the front lines, right? They're taking care of COVID patients. But everyone should call. Now, LA County and LA City have joined together to create a lot of different testing sites, more than 35. So in your area, please make sure you look in your area to see where your testing sites are. They're different in different states and different counties. So you do not have to pay for your test. That should not be. So if someone says you have to pay for a test, you need to look into a different testing site. There's priority, as I stated, with healthcare workers. Also, if you're in a hospital or if you're in ICU, of course you need to have that priority because they need to know how to treat you. So you need to have that. If you're symptomatic with underlying conditions, medical conditions, or if you're 65 and older, you are the priority. So you will get that priority testing. Now, with the safer at home orders since back in March, now they have drive-through testings available as well, as you have seen that on the news as well. But like I said, make sure you call your area and your state, get your appointment, because the lines are longer now and they're taking longer. So just be patient, because you may not get seen that day, but be patient. Bring your patients to you because we have increased exposures now. Now, the pandemic is causing more positive COVID testing for healthcare workers because we're more exposed, right? So we have our SEIU Union 721 that is fighting for us to try to ensure that we have as much PPE as possible. But as you know, we have a national shortage. So we have to continue to protect ourselves, and sometimes we're reusing equipment that we shouldn't be reusing. Now, the particular masks that we use, we call them N95s. They have a clamp at the top, and they're fit tested for us. So we are fit tested for these to fit us in particular. This is what saves us. 95% of the particles will not get into us. We also have what we call a surgical mask. A surgical mask is usually what, if you have symptoms and you come to the hospital, they're going to have you wear this. This protects us from you. So when you cough or sneeze, it's going into the mask. That's what they usually have. Also, you may see the nurses in gargles. They may have a face shield on as well, a plastic covering over that. And then you're going to see us in gloves, right? And you're going to see us in gowns. These should be water-resistant gowns. So you will see us in these different things. So don't be surprised. I'm showing you this so you won't be surprised. This is just to protect the nurses and the doctors and the respiratory therapists from having exposures and possibly getting the coronavirus. So I just want you to know that you will see that type of gear. Some of them we have the poppers where they have the four headgear with the tubes coming out the back and they have a side PowerPoint. Those are the ones who can't fit the N95s for one reason. Sometimes it's men because they have beards, or if they can't find the proper fit for you for N95, then you use those particular machines. So those are what those machines are. Now, healthcare workers, they're testing positive, and they're also they are dying, and I'll give you those numbers in a minute. They're testing. So we're trying to ensure that we get all the proper gear. Also, there's head covers. There's also foot covers that we can use when we're working with different patients and clients in the communities and in the hospital. So also, we're trying to have ongoing available to have sick time without being disciplined, because we do get sick as well. We have the same requirements as everybody else. We're human. We do go over and above, and people call us heroes, and we do contribute to helping people maintain and save their lives with the doctors and the respiratory therapists and all of that. But we have families, and we get sick as well. So we're fighting with that, and our union, SEIU, is helping with that. Our fierce leader is Katarina Thomas. She is helping us fight that fight. So thank you very much, Katarina, for your leadership, for all your nurses. We really appreciate you and love you. Now, the impact on healthcare workers, if you go to the DPH, this is for LA County. Now, you have it in your own area, so you would have to look in your county, but this is for LA County. As of July 9, 2020, there's a total of 9,428 healthcare workers and first responders that have been confirmed with COVID-19. Now, some of them are asymptomatic cases, about for 8% of all positive healthcare workers and first responders. Demographics shows 2/3 of the cases were women, which is 66%. More than 1/3 were Hispanic, Latino, or Hispanic origin, 44%, and over half between 18 and 40 years old were 52%. So you see, it's every age, so it's not just for you young people, 52%. Cases have been identified among 28 different types of occupational settings. There's skilled nursing facility, long-term facility. We call them congregated communities, where you in an area, where you in that community. Long-term care facilities. They continue to have the highest proportions of all the cases, but their percentages are going down since DPH are doing better accomplishments on getting in infection control, and our surveyors are going in there to help assist them with those different things. Most of the nurses, when I say nurses, it includes registered nurses, licensed vocational nurses, and certified nurse assistants. Also, it continued to account for the majority of the cases, which is 40%. So the nurses have the biggest hit. But their proportion continues to go down as the roles increase. Over 1/3, 37%, reported being exposed to known cases within their facilities, either from the patient and or co-workers. Sometimes we get exposed to our co-workers. We're in our lunchroom, you got to take your mask off, and you don't know that that person has COVID because they're asymptomatic, and you get exposed. So that's another way that we can get exposed from our co-workers. And 14% had known exposures outside of their facilities, such as family members or travel. Sometimes you get it from family members, like the young ones that go out and then they come back and they're asymptomatic and they bring it home, so then you're exposed. The rate of hospitalization recently, it remains low, only like 5% of the cases, like for healthcare workers. Once we become positive, we're only 5% in the hospital, which is great. We don't really want that for anybody. But right now, this is for LA County. Remember that. This is for LA County. There are also 61 healthcare workers that have died. So we get sick, and like I said, we die too. The majority were men. That's why I said men go to the doctor. 51%, and that was between 41 and 65 years old. Also, they had a known comorbidity, meaning they had a medical condition already, like the heart disease or the lung disease. Comorbidities were 79% of those who died. Skilled nursing home staff was 72%, and nurses were 51%, continues to account for the most death. Nurses are, we're there. We're doing all that care with you. We're there for several hours, and we're there 24/7 with you. So nurses are right there in the ditches with you, taking care of you. All this data was reported from different interviews and email reports directly from the facilities, from the outside jurisdiction, as the world resides outside of LA County, but they work in LA County. So LA County is including those. Now, there's different positive healthcare workers across the states, across the world, across international. I don't have all those current ones because they're not really listed, but the ones I have, I know Italy, China, Indonesia, total cases, there were like 9,608 deaths, 92 MDs and nurse practitioners. Now, it may not be current because it's not really updated that often. We did have Kios Kelly. He was assistant nurse manager that died in March 25. He's in New York. He worked at Mount Sinai. Okay, his death was attributed to a lack of all the proper PPE. He would put on garbage bags to try to mimic a gown to cover himself because there was none available. That's really terrible. And this was according to his peer, Amy Lee. She said she observed him like this. And sometimes he would jump in there, and nurses tend to jump in there too without being fully PPE'd up, personal protective equipment, because we respond. It's a natural thing for us. So we have to really make sure that we take the time to put on the right PPE as well. Now on 410, there was a Maria Carrier. She was a 59-year-old nurse, and she was in Massachusetts who died, and she was in a convalescence home environment. So she actually resigned and left, but then she finally got COVID and she passed away. Also, Harriet Ryan in per the LA Times, Brittany Rango. She was a 32-year-old black RN, and she died on April 30th, 2020. Now, she was at the Silverado Beverly Place. This was another congregate setting, and that facility was supposed to be locked down, but she received in a retired doctor from New York, and she knew he had symptoms, and she didn't want to admit him, but they told her that he had to be admitted. He had a fever of 103, and he was sweating profusely. The next day, he couldn't breathe, so she called 911. He made it through, but Brittany died. There was there were 63 other residents, and 9 others also died. So this is nothing to play with. This is serious. When I see people on the news saying, oh, it's not really true, it's not really that significant, but it is. This is happening. People are dying. It's not like you get an infection, you get an antibiotic, and you go home. People are dying. So you have to take this serious. Just in our county, July 17th, we had more than 6 nurses test positive for the coronavirus because we're constantly exposed. And I'm sure it was several other facilities too, because they don't always tell you. Well, you don't find out the names because of HIPAA violations. But sometimes our nurse peers will tell us, and that's how we find out that our buddies are testing positive. So this is happening in multiple facilities across the world. It's not just in our current county. So this is happening everywhere. And once you're exposed, they're supposed to notify you if you had a close contact, and then you got to quarantine yourself for 14 days. Hopefully you don't get sicker and you don't have to go into the hospital. You'll recover and you'll still be able to go back to work. Usually before you go back to work, you have to have at least 3 days where you don't have fever or symptoms and you're not using medication to decrease your fevers. It's medication, fevers without medications. Now, a lot of the problems is also appropriate PPE. Some of us have to reuse our PPE. We should not have a national shortage still at this time, but we do. So it's really sad that our federal government can't get it together so that we can have enough PPE. Because, when you're tired, you make mistakes. You start touching your face. You start touching your nose and different things like that when you're tired. Or you have to keep taking off the PPE and then put it back on the same one. Then you're apt to expose yourself from that because of that. So make sure, no matter what, nurses, just put it down. Go wash your hands first. Don't wipe your face and things like that, because it's better if you just let it roll, because I want you to stay safe. All healthcare workers, including nurses, how environmental services that clean the different rooms, they need the same PPE protection, because no matter what people are saying, it's airborne. How else we became a pandemic? Measles, tuberculosis, those are supposed to be airborne as well, and they're not pandemics. But we have a pandemic with the coronavirus. So go figure that one, right? So you have to protect yourself. Okay, so the other thing is, according to the Healthline webpage, experts say testing is only a partial explanation of the surge of the coronavirus and the hospitalization. You have to have it to get positive tests. That's what people are not connecting it to. So you have to have the virus to become positive. The reopening of business and the lack of reinforcements for wearing the mask is a major factor, is why we're like out of control right now, because people didn't wear masks, and some people say, oh, it's violating their personal choice to not wear a mask. Then you should not be out in the public. Stay at home. You can keep yourself at home and social distance completely, and then you won't have to wear a mask. So don't come out in the public without your face mask. Now, there's different types. Like I said, we have cloth masks as well. You have different masks you can get online, so there's no excuse. But look at it this way. You can even make a mask out of cloth. Now, first they tried to say it was blame on the protesters and things like that. And it's possible they could have got it. But we had holidays as well. We had the Memorial Day. We had the 4th of July. So these are indwellings, gathering with family members outside of your home. Like inside your home, you were there with your family members and everybody was safe. But then when it reopened a little bit, people started gathering with other family members, and then that's how some of them got exposed, because they did that. Or getting around friends, like young people going out to the bars. And the bars, when you're drunk, you do not do social distancing. There was not enough masks. So this is contributing to the increase in the coronavirus. So when it's just, you just have to talk to your family on the phone. Right now, it's not great to gather. It really isn't. Especially if there's someone in the home that has these comorbidities, or they're 65 and older. We just can't do that. We have to stay within our family. Do Zoom, do FaceTime, call each other. That's the way we have to do it right now, because what's happened is, because we've been so lax, we've increased our hospitalizations by 30% in the last 2 weeks. That is just really too much. So what I want to show you is, in the pinch, say for instance, you don't have money to buy masks. Well, you just get a piece of cloth, right? You fold it in half, and then you fold it again so that your halves meet up, so that they're like that, right? And then you get some rubber bands or hair elastic crunchies. You put it on each end, right? And you fold that over. You fold it over, right? You fold it over. So then you grab the elastic parts, you put it on, You can adjust it, right? Okay. Now, you can do the same thing with paper towels. I mean, I remember I went to the doctor's office and I saw these two girls without any mask on. So this is paper towels, and this is 2-ply. So I got 4 and double it up, right? And you do the same thing. You fold it down. I got 2 rubber bands from the desk, from one of the clerks there in the office, and I fold it down. And in a pinch, you have a mask. That's 4 or 5 layers, which is great. So there's really no excuse not to wear a mask. Now, another thing I want to mention is the improper wearing of a mask, right? So you put it on, right? You have to make sure that you're covering your nose. It cannot be like this. If your nose is out, you're not protecting everybody, because you can get the coronavirus from exhaling. So this is not the proper way to wear a mask, nor is you putting it down here, right? This is not protecting anything. It's on your neck. So you have to wear the mask appropriately. You have to make sure that the mask is covering your nose and your mouth, like so. Nose and mouth. Otherwise, you're not going to be protecting anybody or yourself. So make sure you're wearing your mask appropriately at all times. So we're seeing higher cases in young people. Young people go to the beach, they go to the parties, they go to the bars, and what do you see? They have these close gathering parties, these pool parties, and they're not wearing any masks. You have to wear masks. And so what happened? Okay, 2 weeks later, now we have this huge surge of young people, and young people have actually died. So young people, yes, you do. You're not exempt. This happens to everybody. And then on top of that, you can be asymptomatic, meaning no symptoms showing, but you still have the coronavirus. And they found out when people are coming back in for elective surgeries, they always test you before your surgery. And they're coronavirus positive. They're asymptomatic. So even if you're asymptomatic, you can still be spreading the virus and you don't even know it. And that's why you have to wear masks. And this is another reason why we have increased hospitalizations, increased ICUs, increased people coming to the hospital. So then us nurses, doctors, respiratory therapists, we all have to deal with all of that, and we have increased exposure because there's so many people coming into the hospital. Nobody's exempt, nobody's superwoman, nobody's superman. Coronavirus do not care about your age, doesn't care at all. So yes, you can get the coronavirus, and you have to protect yourself and your other family members, because you can pass it on. So my young sons, they can pass it on to me and my husband. So this is why you have to wear masks. Now, the large hospitals are getting inundated now. So now they're looking for some of the military to provide them for some relief, which is needed, right? Because all of a sudden, boom, you're impacted with all this influx of people. And then also they're trying to take care of the people, and they don't have enough negative pressured rooms, meaning isolation rooms with negative pressure. That means that air does not come out into other rooms. It stays in that one particular room. That way other people don't get sick, because it travels if it's out, right? And we know it travels. So there's been plenty of scientific proof that shows when you cough, within 40 seconds, that droplets and airborne particles can go up to 12 feet, past 12 feet. Okay, so we know it travels in the air. Now, the other reasons why things are happening is that People are not washing their hands. I mean, it's really simple. You wash your hands. Start teaching your kids to wash their hands for 20 seconds, front, back. Make sure they wash it under your nails. Keep your nails short so that you can keep your nails clean. Have them sing Twinkle, Twinkle, Little Star or Happy Birthday. Have them practice wearing their masks because kids put them on and they take them off. So you have to start teaching them to be comfortable wearing their masks. So while you have them at home right now, teach them to wear their masks. Teach them to wash their hands because kids typically will not keep it on. So you have to teach them. And the younger they are, the faster it comes off. So parents, start teaching your kids because this is very important. Right now, they're not going back to school because why? It's not safe. They have to ensure that children are safe before they go back to school. And early on, they didn't think kids could get infected. Well, now we know it's changing. Everybody can get the coronavirus. No one's exempt. And they don't really know why some get it and some don't. I'm sure they're still doing research on that too as well. Now, how do we slow the spread? Wear your mask. Wear it properly. Cover your nose and your mouth. Right? Nose and mouth. Teach your children the same thing. So you need to practice with your children so we can slow the spread. Tell your young adults, tell your older adults, and for older people, do the same thing. Wear your mask. For your elderly people, it's better if they don't go out around and shopping. You know, if someone can help them do their shopping. There's also Instacart and different grocery deliveries that they can deliver right to their home so that they are safe. So you want to shop for them. Now, also, you've seen in the stores where these fights are happening because people are not wearing their masks. One lady said she couldn't breathe. Okay, you should have people shopping for you. You shouldn't be out there then. Don't expose us because you can't breathe. So wear your mask, keep your social distancing, stay within your household. Stop going to visit relatives. Stay within your household. You have to do that for now. It's just a whole different way of life that we have to adjust in order to get control over this virus. We have to do that. And you can wash your face cloth masks. You know, you throw them in the wash. You can hand wash them and put them up. You don't want to keep reusing them and you don't wash them. So you have to wash your mask as well. Whenever you decide, if you're out and you take your mask off, you want to make sure you wash your hands very well because you're touching all of the stuff that's on the out part of the mask. So you want to make sure you're washing your hands. 20 seconds. It has to be 20 seconds or more. Now, there are certain restrictions. Now, kids that are under 2, they can't wear masks. They panic and they tend to not be able to breathe properly because it scares them because it's over their face. So you can't put a mask on them. So they should not be out shopping and out about, right? If they can't be protected. And we know now that they can get the coronavirus. Now, if you have people who are incapacitated or unable to remove the mask, then of course they cannot wear the mask. You have to assist them. Now, there's some feasible adaptations per CDC. Now, cloth coverings may not be possible in every situation. Some people in situation wearing a face cloth covering may exacerbate the physical and mental health. So some people get anxiety, they get claustrophobic, and they get anxiety that can make it worse. They start hyperventilating and they can pass out and it can make them worse. So there are some medical conditions where this is an exception. Also, alternate consideration whenever possible with increased feasibility of wearing cloth face covering to reduce the risk of COVID. Spreading it is not possible to wear one. For an example, people who are deaf or hard of hearing or those who care for those interaction with those people. Hearing impaired because may be unable to wear the cloth face covering if they are relying on lip reading. If they're relying on lip reading for communication, if you cover it up with a mask, they can't see your lips unless you have a clear mask so they can see your lips. Okay, but this is a consideration. So you got to remember that. So capturing the different decrease in background noises, because they're having a hard time hearing, so that may cause a problem with them as well. And you covering their lips, which they use to help understand what's going on, because they read the lips. Some people with intellectual disabilities, autism, it's hard for some autistic children to follow those instructions and keep it. You have to stay with them to keep them focused because they can't retain it. They have a lot of nervous energy depending on the type of severity of the autism. So those are some of the exceptions as well. Other sensory activities challenging, some of them don't like noises. They don't like a bunch of people. So it can make them worse. Younger children, preschool, early elementary, may be able to wear the cloth mask, but not if they're under 2. They can wear it for periods of time. So you have to start teaching them to be comfortable wearing the mask a little bit every day, a little bit longer, until you can get them to the total hours required for school. Because this is where you have to prepare them to be ready for that. Okay, so parents, this is what you got to do. You also have to teach them how to social distance. A lot of kids don't like that. I went on a home visit and the kid wants to come and grab me and hug me. It's hard for them to do it, but you have to start teaching them the importance of keeping the social distance. So with kids and even with adults, it takes adults at least 3 times with new information before they finally get it. So you can imagine what it would take for children. You have to keep practicing every single day until it becomes what they call muscle memory, meaning they'll do it automatically and they're comfortable doing it. So parents, this is on you to teach your children how to wear their masks, how to wash their hands, and how to social distancing. And remember, you are the model, so you got to model it appropriately. Now, even when they're out and about, you got to teach them how to keep the social distancing. So you can practice by going out in the backyard. Okay, this is where you should be. This is about how it looks. So most schools and different organizations will have things marked off. So you can put some tape in the yard or a piece of rope or something to teach them, hey, here's your mark. You have to be on that mark. So start teaching them, start practicing with them, start educating them on all those different issues that they're going to need to have and master before they go back to school safely. So start getting them ready. Okay, now you can't wear a cloth mask, of course, while you're swimming, right? Because you're in the pool and you're in the water. So if your mask gets wet, it's not effective. So you can't wear it while you're swimming. So you have to limit where you are if you're swimming, because you can't wear it while you swim. You definitely have to social distance or don't swim. You have to make these choices. Same thing with beaches and pools. And the pool party, what happened? They're right next to each other. That is totally inappropriate. You can't be that close, that clutter. That was like too many people even before the coronavirus. And they're all close together. You can't do that. Stay away from pool parties. Stay away from parties. You don't need to be doing that right now because a lot of people are asymptomatic. So you can't wear it while you're swimming. You just can't. And you can't, if it gets wet, and it's not going to do you any good. So you just have to choose to do some other activity. If you're lucky enough to have a pool in your home, fine, that's great, that's fantastic. But don't be inviting a bunch of people over to have a pool party either. That's not what you should be doing right now. All these social gatherings. Remember, it's just only your family in your immediate household. That's it. Nobody else. So you have to start practicing this and make sure you're doing that, and make sure you're covering your nose, because The coronavirus can be spreaded through coughing, sneezing, exhaling, meaning breathing out, which comes out of your nose. If you're a mouth breather, it comes out of your mouth. Some people can't breathe through their nose. It comes out, right? And also with talking. So don't forget about the talking, because that can happen with talking. So you have to have your face covering up. You have to have your social distancing. You have to. Now, at your job, there may be certain machinery that, it may get caught, so it may have to be a different type of mask. So that's between your occupational environment that helps you in the job. So each job is going to have a different requirement if there's different machinery or whatever the situation may be in your employment. But your employers should be able to guide you and let you know what's safe for you to do, right, in your profession. So everybody, office business is not going to be set up the same way for safety. So you just have to work with your employer, follow your employer's instructions. I mean, I'm in offices and people are not wearing their masks, or they're wearing their mask below their nose. No. That's not helping you. Wear your mask. Cover your nose, cover your mouth. Now, some facilities are testing your temperature before you go into your facility to see if you do have symptoms. So if you do have symptoms, then you should not be going to work. You should not be going anywhere if you're sick. You definitely shouldn't be going out into a store and then you don't have a mask. But don't go. If you're sick, don't go out. Stay in. Do not go out. Stay in. You're becoming a super spreader because you're sick. Now, then you want to make sure that you don't cause increased anxiety on other people that are wearing their masks in the stores, because they're going out to buy their food and they're not sick, they're compliant. So if they have to tell you to put your mask on, you're increasing their anxiety, and then you get mad and then you want to fight people. We've seen it on the news where people get into fights, really, because of the mask. If you don't want to wear a mask, then stay home. Shop online. Stay home. Talking about this violates your civil freedom. Then stay home. Don't go out. Stay home. You have a choice, so choose to stay home and don't endanger others if you don't want to comply. That's just something simple to do. So that becomes dangerous. If you cannot wear a mask, one lady said she can't breathe. Okay, then have someone else shop for you, or shop online and have them deliver your groceries. Don't be in the store, and don't be mad if people confront you because you don't have a mask on. Whatever the different exempts I've given you some examples, then you need to be at home. You do not need to be out and about. And remember, we have to protect the children as well, because they're getting sick as well. That way, the other shoppers won't have to be worrying about fighting with you. Now, another thing I want you to do is, in order to protect yourself as well, you have to make sure when you bring packages into your home that you're wiping them down, you're cleaning them. And then even with the mail, you're washing your hand after you deal with those packages. What I usually do is I get a cloth and I soap it up with antibacterial soap, and we wash it down. We clean it down. So packages, cardboard, steel, plastic, the coronavirus lands on it and it stays there for several hours. So you want to make sure that anything you bring into your home, you're cleaning it. You don't have to spray it, because it winds up wasting a lot of money and it goes out quickly. So I've used antibacterial soap, or you can make a water with antibacterial soap with a little bleach, and you can clean it that way. You can also make your own bleach. You can put a fourth of bleach in a bottle and then fill the rest with water, so you can make your own bleach mixer. Now, to take care of yourself, it's a good idea to eat broccoli, because you want to increase your zinc. So broccoli, avocados, those are good, and almonds, cashews, those are good supplements. Berries, blackberries, those are also good. So your blackberries, and when you get your berries, just so you know, to keep them longer, you just wash them and you freeze them, and then you can take them out when you need them and they don't go bad. So you don't keep wasting your money, right? You also want to increase your acid content. So you want to have lemons and oranges. Those are good acid contents, as well as avocado. Who knew avocados, right? Mangoes are good sources for zinc as well. And if you don't have it, you can also have zinc supplements. You can get that as well. I recommend that you take vitamin C, at least 1,000 milligrams a day. You want to make sure you have I take B complex. I have a multivitamin as well. In the morning, make sure you gargle. You know, you brush your teeth and you can gargle while you're brushing your teeth to get that mucus that may be sitting there. And I have a tendency to make myself cough, to make sure I cough it up, to make sure if there is something sitting there, is going to be taken out. So you want to gargle too when you get up in the morning. Another thing I do is I use the Neti Med. And what happens with the Neti Med, it's a cleanser for your sinuses. It has sodium bicarb in there. They have these nice little individual packages that you put in the bottle. It has a line where you have the water. You bring the water and you mix it and you put it in your nose, and it literally washes your sinuses out. You hold your head over the sink and it squirts and it cleans out your sinuses and comes out the other nostril. So this is a good way to keep your sinuses clean. It's another way to take care of yourself. Now, also, I want you guys to know that your money is also dirty. So you want to make sure you wash it, and you can wash it. And I tried it. So I washed it with a little antibacterial soap, and then I let it sit out and it dried. I knew that you could wash the money because I watched all the mafia movies, right? So anyway, you want to be careful of the money. You also want to make sure you wipe down your cell phone, because you know throughout the day you're going to touch it at least 250 times or more. It's just proven research. So you need to, either get a towel with the antibacterial soap. It doesn't matter what type, as long as you just have one that's an antibacterial. That's what's really important. And if you have regular soap and you don't have antibacterial, then add a little bleach in there and just clean it off. Make sure you squeeze it out really, really good, because you don't want it wet. You want to squeeze it out and then just wipe it off. Wipe your cell phone off, because that is a multi-touch area that you do every single day. You touch your phone, your eyeglass cases, right, and your eyeglasses, right. So you want to wipe it off. You want to make sure that you wiping off a lot of frequent touch areas like doorknobs. Bathrooms have to stay clean, right, including knobs, cabinets, refrigerator handles. You go in and out of the refrigerator a lot, right? So everything that you touch frequently every day, you want to keep those clean, wipe those off. So you want to start getting into the practice to do those things to take care of yourself. So the most important thing is when you go out is to wear some type of face covering. It doesn't matter what brand, it just wear it. And like I said, you can even make one with regular paper towels if you don't have the money. I'm going to show you how to do that again right quick. This is just paper towels that you buy, regular paper towels. That's all it is. And I have two. It's 2 pieces, it's 2-ply. And I fold it in half, and this works too. I did it for the young ladies in the doctor's office that didn't have a mask. And you fold it down on one side, and then you fold it down on the other side, right? Like this. And they have how to make masks online, so you can do that as well. You take some kind of rubber band or some kind of elastic scrunchie or rubber band for women's hair, and you put it on each end, and then what you do is you fold it over, right? You fold it over, and you do it on both sides. So depending on how big you want your mask to be, depends on how far you fold it over. And then once it's folded over, like so, then you grab the rubber bands and you put it on. Right? So now you have a mask that's multi-layers and that will cover you. So in a tent, you have a mask. And you can make your mask. You can make it with an old t-shirt and cut it with the cloth like I stated before. It's the same thing. You can cut it out, you can fold it up, and you can make your own mask. So there's really no excuse why you can't make your own mask. And you put the rubber on the end, the same process, right? Same process. So the reason we have an increased coronavirus and epidemic because people are not wearing masks and they're not abiding by the social distancing. So depending on how big you want your mask depends on how you fold it. If you want it larger, you do smaller ones. So you can just play with it and you put it on. And you have your mask. Simple, right? So there's no reason why you can't have a mask on. So for everybody who's out there, everybody can get coronavirus. No one's exempt. Nobody's exempt. Remember that. Nobody's exempt. All ages can get it. All nationalities can get it. So if you think that wearing a mask is against your social liberties, then don't go out. Stay home. Don't go out unless you have a mask. I think there should be a mandate that everybody should have a mask across the United States and internationally. If we did that, we would help slow the spread of this coronavirus. If we would social distance, we would help slow the spread of the coronavirus. If we would wash our hands, we would slow the spread of the coronavirus. So it's really up to you guys to help slow the spread. It takes all of us to get this done. So we all got to participate. You all got to wear the mask, wash your hands, and social distance at least 6 feet. I think it should be maybe 12 feet, but at least a minimum of 6 feet. Don't bring other family members into your home. Stay within your family gathering. So also remember, for us in the hospital, we're going to have the gowns. We're going to have the N95s because we're fit tested. But you can order your own gargles online. You can do that because you want to protect your eyes as well because the coronavirus can get into your eye. So you want to make sure that you're having your goggles as well. You wear your gloves. You can order those online. You want to protect your hands, and then there's surgical masks. So these things you can get online. And like I say, if you're worried about your social liberties, stay at home. That's the way you ain't got to worry about it. If you can't breathe and you don't want to wear a mask, stay home. Order your food online or whatever. They're really good at Amazon, Walmart, and Instacart. They keep you informed. They even send you pictures if it's not your order. What about this one? Instacart is very good at that. So there's no reason for you to go out in the store if you claim you can't breathe or whatever. For whatever reason, you don't want to wear your mask. Fine. Stay at home. Don't go out. Stay at home. Because we have to get control of this coronavirus. And that means everybody. Like I said, if it's against your civil liberty reasons, stay home. Then you don't have to worry about wearing a mask. We all have to participate. Because eventually, if you don't, we're going to see you at some point. Maybe 2 weeks later, 3 weeks later. Depends on if you're exposed. And a lot of people are asymptomatic, so you don't know who has the coronavirus. There's no sticker on their head that says, oh, I have the coronavirus. So, oh, this one's safe, so I know this one isn't. There's no way of knowing because a lot of people who are super spreaders are asymptomatic. So you have to protect yourself by wearing your mask, washing your hands, and keeping your social distancing. Now, you can reach me at Markeitha.com. You can go and see my previous shows. Also, you can reach me at healthyliving.company. But my website is Markeitha.com. I have food products. I have egg toast. I have Peaches gumbo. Gumbo comes with rice and hot water cornbread. So you have to send me a message so I can make those items fresh for you. Also, you can reach me here at the Next Level Studios at 310-549-1113. 310-549-1113. Now, the producer of the show is TJ. talk about some mental health issues so we can survive and deal with our stress during the coronavirus. So I'll see you in a couple of weeks. If something comes up sooner and I decide to do another show, then I'll send you guys a message and I'll let you know. So in the meantime, please stay safe. Wear your mask. Start teaching your children to wear their mask and to wash their hands, because you have to get them prepared for when they go back to school. So start teaching them every day. Have them a little bit longer, a little bit longer. Okay, so then we'll see you. I'll see you in a couple weeks. Stay safe and eat healthy. Eat your big diet. Get plenty of rest. And I'll see you in a couple of weeks. Okay, bye-bye. Talk to you later. Stay safe, everybody.